Hi everyone, this is Sobia. I'm on a mission to make our healthcare system more understandable. Undoubtedly, we have a very complicated healthcare system here in the United States. I firmly believe that gaining even a basic knowledge of how it works will help us make it better. In this brief video, I'm going to discuss our Medicaid system. Medicaid has been front and center in the recent healthcare reform debate in the Congress and White House. I think it's worthwhile to try to understand how Medicaid works, who it serves, and if it provides any benefits to Americans. This video will be the first in a series of videos about Medicaid. I decided to create these videos because Medicaid is a critical, but for the most part, not very well understood part of the American healthcare system. If you're like most Americans who either get their health insurance through work, buy private insurance, or are covered by Medicare, you probably have never used or interacted with the Medicaid system. So in this first video, I'll talk about what Medicaid is, who is eligible, and what types of medical services it covers. The Medicaid program was created in 1965 when President Lyndon B. Johnson signed the Social Security Amendments of 1965 into law. It's important to know that Medicaid is administered by the state, but it's funded by the federal government, and it provides health insurance to certain low-income people. When it was first established in 1965, it covered just 4 million people. Today, Medicaid covers more than 70 million Americans. Medicaid is traditionally thought of as insurance for the poor, but it in fact wears many hats. In addition to being the nation's primary source of health insurance for low-income individuals, it also covers people with Medicare who qualify for dual coverage, so Medicare and Medicaid. It covers long-term care assistance, like nursing facilities and home health care. And most importantly, Medicaid has functioned as a safety net for the nation's citizens at times of need. Historically, Medicaid has provided insurance coverage at times of high poverty rates, high unemployment rates, and when certain segments of our nation have been affected by natural and man-made disasters. Medicaid is what we call an entitlement program. Now that's a term you may hear a lot in the political world, but in the policy arena it has a very specific meaning. It means that if you meet certain criteria for eligibility, you have a right to enroll in the program and receive benefits. So as I mentioned before, the federal government provides financial support to individual states for their Medicaid programs. States have to offer Medicaid coverage to these groups of people in order to qualify for this support from the federal government. So who are these groups of people that the federal government mandates must be covered by states? Well, first, children up to age 18 in families living at or below 138% of the federal poverty level. 138% of the federal poverty level in 2016 was about $33,000 per year for a family of 4. Also, pregnant women living at or below 138% of the federal poverty level. Families living at or below 44% of the federal poverty level. In 2016, this was about $11,000 for a family of 4. And seniors and the disabled who receive cash assistance through the Social Security Insurance Program. States can get federal funding for some optional groups also, such as people in nursing homes with high medical expenses, pregnant women, children, parents who are living above the mandatory income limit, and disabled people living below the federal poverty level. Because states have some flexibility in deciding who gets covered under Medicaid, Medicaid eligibility tends to vary from state to state. For example, 32 states have expanded Medicaid under the Affordable Care Act to include parents and adults without children earning up to 138% of the federal poverty level. In most of the 19 non-expansion states, adults without children who aren't elderly, pregnant, or disabled are not eligible for Medicaid at all, regardless of how poor they are. This pie chart from the Congressional Budget Office shows the proportion of enrollment and spending for the major groups of people eligible for Medicaid. This data is from fiscal year 2015. This pie chart on the left shows that the bulk of Medicaid enrollees are adults and children. But while children account for more than 2/5 of Medicaid enrollees, they require less than 1/5 of Medicaid spending. On the other hand, seniors and persons with disabilities make up only slightly more than 1/5 of Medicaid enrollees. But because they need more healthcare services and more costly healthcare services, they account for nearly half of Medicaid spending. So Medicaid doesn't provide healthcare directly. It's insurance, so it pays healthcare providers like hospitals, doctors, and nurses for the services that they provide to patients. About 3/4 of Medicaid spending is spent on acute care services like physician visits, hospital care, and prescription drugs. The rest goes to nursing home and long-term care services. The federal government requires state Medicaid programs to cover certain services, such as those listed here below. This includes both inpatient and outpatient hospital services, visits to your doctor or nurse practitioner or midwife, getting labs, radiology tests, and in addition to these, family planning, nursing home or home health care, and early and periodic screening, diagnostic, and treatment for children under 21, which ensures that certain medically necessary services are covered for children. Some states will cover additional services like dental and vision, prescription drugs, and personal care services for frail seniors and the disabled. Some hospitals are also reimbursed for uncompensated costs from caring for low-income people. This is referred to as disproportionate share hospital payments and accounts for about 3% of Medicaid services spending. And so this concludes this video where we talk about what Medicaid is, who is eligible, and what services are covered. Thank you so much for watching, and please stay tuned for our next video where we'll discuss how Medicaid is funded and some of the specific situations where Medicaid has been used as a safety net for vulnerable populations. Thank you so much.